New this morning, a new curriculum takes fighting drug overdoses to schools in Rutherford County. Nikki Smith joins us to explain how leaders are trying to bring hope in the face of an opioid epidemic.
Good morning, Nikki. People are dying from drug overdoses all across the country and here in Tennessee. The Tennessee Health Department reports that in 2022, more than 3,800 Tennesseans died of a drug overdose, and opioids were involved in more than 3,000 deaths, primarily driven by deaths involving illicit fentanyl. Now, Rutherford County schools will pilot the HOPE curriculum at 4 elementary schools, 4 middle schools, and its high schools. HOPE stands for Health and Opioid Prevention Education. Their website states that students will develop the skills to make healthy and drug-free choices, including decision-making skills and being assertive to refuse unhealthy choices. Now we talk with Director of Schools, Dr. Jimmy Sullivan, and he says they're starting in 5th grade first to test out the lessons before it's introduced to lower grade levels. It's similar to the DARE program that's being taught by school resource officers, but the HOPE curriculum focuses on opioid awareness and will be taught by health teachers.
It's around medication as well. Make sure that you only take medication that a trusted adult gives you. Don't touch things that you don't know what they are if they're not for you, because that's a lot of times when fentanyl overdoses or any type of opioid overdoses happen, is because kids are taking things that they don't know what they are, or adults are taking things they don't know where they are.
This pilot is a collaboration with Rutherford County Commissioner Craig Harris, who spearheaded a task force to combat the opioid crisis. They approved funding the curriculum from the money the county received from nationwide settlements from drug companies. There was a similar program in schools that got interrupted by the COVID-19 pandemic, so Harris says he's glad to see this opioid-based curriculum brought to classrooms.
I've always believed that our children are the most important things in our life, and we had to show them the ugly side of this. You know, I've always said, I can tell you don't do drugs, but if you see how bad and devastating this epidemic is, I think a kid will look at that and shun it. I think he'll say, you know, this is too ugly. I don't want no part of this.
Dr. Sullivan says they will work with parents who have children that may have experienced drug abuse in their family and want to opt their kids out of these lessons. Lessons will also have tests before and after they're taught to see their effectiveness. Neil.